Slone Partners welcomes Alan Mertz, President of ACLA, American Clinical Laboratory Association. Alan, welcome.
Thanks for having me. Glad to talk to you.
Given the success of ACLA over the past 10 years, what do you think are the key factors to the growth in membership and increased visibility in Congress?
I think the success has been, it's largely the active participation of our lab members. We have laboratories have really actively participated in ACLA. They come with us to Capitol Hill. They join us when we go to the administrative agencies, to Medicare or other agencies. They go with us. They also, our members provide us with the expertise that we have a small staff of only 8 people here, and so it's hard for us to cover the waterfront. So our many members provide experts, whether they're PhDs or pathologists or laboratorians. They provide us with the expertise and the information we need to be effective. So that plus having a good staff, I think has meant success. The other thing I would mention is the reason some industries don't do as well in advocacy or lobbying is because their membership is so divided over issues they can't ever come to a consensus on what their position is. And we've rarely had that problem. The laboratory industry's been pretty good in working together and having a consensus and not having a lot of internal bickering. So we can have a set objective and we can go up and lobby. And finally, we have a great story to tell. Laboratories are, the value of what we do to our healthcare system is so incredible that we're only 2 or 3% of the spending, but we influence 70 or 80% of decisions. It's a great bargain for our healthcare system. So that's effective, and policymakers sit up and listen when you have such a good story to tell.
With the growth in molecular medicine and interest in oncology testing, does that impact your membership base, and is that going to impact how you continue to grow?
It does, because much of the growth in our membership has been in laboratories that specialize in genetic testing, that might have one test or a few tests. Startup companies, laboratories that have now, some of them become quite large actually, and they've kind of grown with us. And then also it has the reference laboratories that we have, like ARUP or Mayo or others, as they do more genetic molecular testing, they've grown quite a bit too. So our membership, the number of members have grown, and the size of our members that we had, they've grown because of the growth of genetic and molecular testing.
I'm thinking that you might be able to comment on this, having taught at the university level. What do you think a university or universities globally can do today to attract young people into careers in laboratory medicine?
I think we probably need to do a better job in terms of educating young people for some of the needs of the healthcare sector. And with respect to laboratories, I see 2 particular professions where there's going to be, I think, almost, I won't say unlimited growth opportunities, but tremendous growth, and they'll always have a good job opportunity. One is at the medical technician level. No matter how automated tests become, we're always going to need lab techs, and we're going to need them all over the country. And I think the universities do need to do a better job in training more lab techs. And part of that is the government too. It's not just the universities why we don't have enough of them, but the government has to get more involved in providing support to universities to educate people and become lab techs. And then there's the other end of the spectrum, all the way up to the PhD level. What we're seeing in genetic testing is most of the genetic tests that are now being performed are being overseen, more and more of them being overseen by PhD geneticists. Pathologists, yes, continue to have a vital role to play in anatomical pathology, and obviously there'll always be a need for that. And some of the genetic tests, the pathologists are involved, of course, but we've just had an issue recently where the Medicare was going to decide whether to continue paying for genetic molecular tests on the clinical lab fee schedule, and that's where PhD geneticists can perform the test. And they were considering, there was a proposal to put them over on the physician fee schedule where it would have to be a pathologist, and a geneticist couldn't do it. But the government was very strong in deciding to keep them clinical lab fee schedule. PhD geneticists would be able to perform them. And so that's a clear sign that I think we're going to, and genetic molecular testing is growing. We had a study done that's growing. It grew at about 100% in the last 5 years.
Wow.
So it's been doubling. And overall, there's something like over 100,000 jobs that have been created in molecular genetic testing over the last 5 years or so.